CBS News medical consultant Dr. David Agus joins us now with more on the pandemic. He's in Los Angeles. David, that was a striking number that Tom Hansen just spoke about. So far right now, we know that 3 states reported cases of the UK variant of COVID-19. Now they're 8. So what should we know about this?
Well, there are 2 variants, the South African and the UK variant. The South African is the one I'm really worried about. There's no question the UK variant is in the United States, 8 states reporting, but there probably are many, many more. We're not sequencing enough RNA of the virus to actually know which variant it is. And I bet you the South African variant is here too. So we have to be aware, and we have to vaccinate as much as we can, as quick as we can.
Yeah, we heard the number from Tom there. Friday, President-elect Biden said that he would release all of the vaccine instead of keeping it in storage and holding back that supply. What's your view on this?
Well, I've been talking almost daily to the Biden team, I mean, the COVID team, and certainly every vaccine that is available should be given to somebody. It should not sit in a freezer anywhere, whether a state or the federal government. So the sooner we get the initial vaccine out there, the better we're going to do. With 1 shot, you get about 60% of immunity after 10 to 14 days. And then hopefully weeks later, you get that 2nd shot where you can really get the full immunity. But we have to get it rolling out better across the country.
Right. So, but doctor, the question is then, the rollout has been slower than many people hoped. Do you see a significant improvement in the weeks ahead? And I think maybe more importantly, if we're looking at dates and timelines here, a few weeks ago, the government said that they hoped by June, everyone who wanted a vaccine would be able to get one. Do you believe that is still possible?
Yeah, I think it is possible. I think and I and many others are pushing to aggressively approve the Johnson & Johnson vaccine as well as the AstraZeneca Oxford University vaccine. Those vaccines are much easier to give. You don't have to freeze them, and they can be given in regular doctor's offices instead of in big hospitals or large parking lots. And so I think if we have more of a supply distributed across the country, we can do it. You know, the first couple of weeks were very, very slow. And I will tell you, just myself, getting that first vaccine, it took me 15 minutes for them to get through the software and get me registered because it was the beginning. When I went for my 2nd shot, it took seconds, and I went in and I was out.
And doctor, in the 30 seconds we have left here, if someone is sitting at home watching and waiting for this vaccine, should they be calling their doctor? Should they be waiting for a call? What should people be doing right now who have not been vaccinated?
Every state is setting their own criteria by age, by medical condition, et cetera. So look on your state public health website, and you'll get a sense of where you are in line. And based on that, you know, what's going to happen. And some states are doing it in hospitals, others in pharmacies, and they're going to announce it. My gut is when the Biden administration takes over, there will be more of a federally directed program on how to distribute it across the country.
Okay, Dr. David Agus, as always, thank you very much.